Welcome to the Minnesota Home Care Association's 10 Talks video series. I'm Karen Peterson, Regulatory Affairs and Advocacy Manager. Thank you for joining us. Advanced care planning is the process of thinking and talking about healthcare decisions that still have to be made, even when the patient can no longer participate in these decision-making processes. Today, I'm going to be sharing some information and resources to help you have serious conversations with your clients and patients about advanced care planning, including CPR and intubation during this time of COVID-19. We will be focusing on how to start and carry out this conversation with your clients and patients, but the first piece of advice I actually have for you is to do this yourself. I strongly urge you to think about your own personal situations, whether or not your loved ones know what you would want should your health change suddenly, and whether or not you are confident you know what choices to make for your spouse or your parents, siblings, or children based on their values and preferences. Having your own advanced care planning done helps you in two ways. First, it helps you understand just how challenging this is for those you are caring for. And second, it makes a huge difference when you can honestly say to your clients or patients, I've done this too with my loved ones. Next, you'll start your conversation. I'm going to share 10 steps to help you navigate this process. Start the conversation with, I'd like to take some time to talk about advanced care planning with you. This is something we do with all of our patients. Would that be okay with you? Putting it this way lets them know that this is a normal, routine process for everyone, and asking permission gives the patient or client a feeling of control and involvement. Then we move on to the public health emergency that we're surrounded by. You might start with something like this. Because of what's happening right now, let's begin by talking about COVID-19 so that I can answer any questions you have about it and we can talk through your concerns. What do you know about this virus? Then you need to be quiet and wait. It can be so tempting to jump right in with facts and details and statistics. Resist that temptation. Offer therapeutic silence, which gives them time to process their thoughts and share what they're concerned about. Their top concerns are likely not going to be exactly what you expect them to be. If possible, bring their primary caregiver, their spouse, adult child, or children, or whoever is closest to their situation, into this conversation as well. As your patient talks about what they know about COVID-19 and what they are worried about, you might want to ask some exploring questions, such as, can you tell me more about that? What does that look like for you? How does that make you feel? As you move on, keep it conversational with a back and forth pattern to avoid overloading your patient with too much information too fast. Now it's time to start sharing more details. One of the challenges we have learned with COVID-19 is that people can have it and expose others to it for up to 2 weeks without knowing it. That's why I am now wearing this. What are you doing to protect yourself? Listen for them to talk about washing their hands, being in quarantine, limiting their visitors, etc., and thank them for their actions before moving on. Have you heard of what symptoms and signs you could watch for with COVID-19? Give them time to think about it and offer their answers, which will let you determine what their level of understanding is and if they've been affected by rumors or misinformation that is floating around. Affirm the answers they give that are right, and for those that are not correct, gently offer the real situation. Then fill in anything that they may have missed. This might also be a good time to ask if they know anybody personally who has contracted COVID-19 and how it's affected them. Many people can make it through a COVID-19 infection on their own, but it can be more difficult if the person already has some type of a health issue or condition which makes them more vulnerable. Where do you fit in that regard? They should reflect on their underlying conditions or diagnoses and how that might make them more vulnerable. If the spouse or primary caretaker is part of the conversation, encourage them to consider what would happen if either of them became infected. After they've shared their thoughts, fill in with what you know about their situation. It sounds like you have a fair understanding of this new disease. Do you have any questions for me about it? As the questions come and the discussion slows down, you can start into an explanation. I brought this up with you today because unfortunately COVID-19 is proving to be a disease that can advance quickly. Because of how easily it can be transmitted to others, if you were to have to go to the hospital, your loved ones would probably not be allowed there with you. Watch for their nonverbal cues, see how they're responding to this idea. And then go on. If you are in the hospital and your breathing gets to the point where the healthcare team is recommending a breathing machine, a ventilator, there may not be time for phone calls and discussion. So that discussion needs to happen now, what we're doing today, just in case. Watch their faces. You may need to adapt this section based on their diagnosis and level of comprehension, but hopefully you will begin to see some nods of understanding. Now it's time to reflect on the conversation so far and take time to explore some of the things they have said and offer reassurance and affirmations that what they are feeling is okay. It may be helpful to prompt with questions or statements, such as those shown on the screen now. From here, the conversation can follow a normal advanced care planning conversation process. Use their current health status as your starting point. Explore their understanding of intubation. Determine how well they comprehend what CPR involves and what the side effects can be. And bring in their personal goals, values, and other preferences. It may be helpful to have some written information to share with your patients or client and their loved ones. Honoring Choices Minnesota has some excellent informational resources on CPR, help with breathing, and COVID-19, all available for a free download. These are designed for patients and family members and are good leave-behinds. In addition, the Minnesota Pulse website has guides for you to use if you are looking for additional guidance. There are versions for hospice, assisted living, and home care patients. After your talk, documentation of your conversation is absolutely critical. There are 3 key points: naming an agent, determining preferences about CPR and intubation, and getting the patient's primary care provider involved. First, you'll want to have the patient decide who they want to give decision-making power to in case a time comes when they can no longer make their own decisions. This person is referred to as the healthcare agent, or sometimes simply the agent for short. Document their choice both in your notes and by having the patient or client complete a healthcare directive. Pictured here is one option, the short form healthcare directive from the Honoring Choices website. I like it because it's quick and simple, but other forms can be used, or you could even write it on a blank piece of paper as long as legal witnessing requirements are met. Second, you'll want to discuss life-sustaining treatment options. For many years in healthcare, we have routinely said DNR, DNI as if it were one choice, but really it's 2, CPR and intubation, and each needs to be talked about and decided upon independently. With COVID-19 having such significant respiratory impact, it's very possible for someone to have different answers to the questions, do you want us to try to restart your heart if it stops beating? And do you want us to use a machine to keep you breathing if your lungs are not working? This may be a time when your patient or their caregiver asks about shortages of ventilators in the ICU, or bring up stories they have heard about doctors having to prioritize patients' access to vents. If so, use this as an opportunity to point out why it's so important to talk about these things ahead of time. Document this conversation both in your notes and have the patient add their preferences about CPR and intubation on the healthcare directive. Finally, it's very important that the patient's primary care provider is brought into the conversation as soon as possible, just in case the patient's condition changes rapidly. If the patient has clearly determined that they do not want resuscitation attempted, or they have specific instructions about what treatments they want or do not want, they really should have a pulse. You can complete the pulse form with them and then fax it to their primary care provider to be signed. Or you can help arrange a telehealth appointment with the primary provider to discuss the POLST form with the patient and complete it. Having a completed POLST is the best way to ensure that if your patient is hospitalized, their wishes will be followed, as a POLST is a medical order. A healthcare directive is not. After these things are all done, make sure that there are sufficient copies ready for distribution. The patient always keeps the originals, but make sure the caregiver has copies, that copies are in their medical record, that the primary care provider has a copy, and it's not a bad idea to send copies directly to the hospital where the patient would most likely be cared for. It's always better to have too many copies than too few to avoid confusion and misunderstanding. A recording of this video with links and copies of the questions and resources I've referred to will all be available on our website. Click on the Provider Resources menu and then on Resources. We welcome your comments and questions and hope you will watch for more 10 Talks videos. Thank you.